It's Chopping Up with Shelly over here at Hollywood's Barbershop. I got Dr. Paris in the chair today. Tell me what you do for your profession.
My profession, I'm a physician, been one for 30 plus years. Um,
So you know what you're doing?
I sort of know most days, do more aesthetic medicine now, so minimally invasive cosmetic procedures, Botox fillers, laser treatments, lump and bump removal of moles and things like that.
Now,
Skin resurfacing with the lasers, laser hair removal, things like that.
now, a lot of people are like, "Oh, that's all for When you think of Botox and all these things that you do, I think a lot of people would right away think that this is a message for women,
Right.
But what kind of services can you provide for men that maybe men don't really necessarily know about
You know,
in your field?
a lot of men are not a lot, but more starting to come in for Botox. It's something that's really
Hmm.
simple. It has pretty quick results. Just it's a nice type of refreshing treatment. Helps minimize some of the lines on your forehead, between your eyebrows, around your eyes. So I would say it's becoming a bit more mainstream, especially people in the public. Uh, Also, people that are in businesses where they have to do sales and present themselves. So starting to see a lot more of that with men. So Botox is good. Fillers are probably not as popular with men in my practice. Some of the laser hair removal, especially in ethnic men who get the hair bumps around their neck, lasers really work good for that because it helps stop the hair follicle or stop the hair from growing. So you can't bump up. If the hair can't grow, then it can't get under your skin and cause a razor bump. So do see some men for that. Do some beard shaping with the laser as well, which is kind of nice.
Mm. Man, you could get really precise with that laser and your hair removal, huh? On
Oh,
the beard and stuff.
absolutely. You just kind of mark it off and protect the areas you want to protect if a man's growing a beard, but you can take care of the entire neck so the hair doesn't grow there. So it really helps smooth that out, helps with the pigment as well.
I would say that would be perfect because a lot of guys are stuck with that 5 o'clock shadow.
Right,
It's just dark all the
right,
time,
right,
regardless of how
right, right,
close they get with the razor.
right.
So that would diminish that, right?
Absolutely. And on top of that, we don't do a lot of this. We do some chemical peels, which can have some lightening properties as well.
Mm. When guys get those really bad, I guess ingrown hairs from shaving and stuff
hmm
like that, what is like one of the treatments that you would have to do if it's like because it can get pretty deep, right?
Right. Some of those, I mean, you really, as a doctor, I'll numb the skin up and
Hmm.
go in and almost de-roof that skin, either with a needle or a little bit of a scalpel, just to unroof that to get that. It's really a curly Q hair that's under there. The hair just keeps growing and growing under the skin. So, you can try exfoliation. There's some products you can try to do to exfoliate the skin and turn it over so that hair pops through. If not, to go in there and do a little bit of a little small poke or incision with numbing.
It's kind of hard. Like I know for darker skinned men, a lot of times they can scar darker.
Correct.
So in that case, like if you
Right.
had like an ingrown hair that
Right.
really did scar you,
Right.
because when you're trying to extract it, of course you're creating hematomas under the skin and stuff.
Mhm.
What would you suggest for like decolorization, like back to the normal pigment?
There's some topical products that are out, some over the counter that you can get, some prescription. We use a compound in pharmacy uh, that will combine three different products for us that really help lighten the skin. Um, Moderately priced, but it's good. It's been around for a while. Hydroquinone is the main component in it, which is a fading product, but we had a couple other products in there too. That will help. I think the hardest part, people need to be patient,
Hmm.
and not re-injure that part of the skin by trying to pick it or extract it themselves. I know people have a tendency to want to think they're helping where they're really making it worse. Making it worse.
And then acne scarring, anything like that, that would be more like laser
Yeah, it'd
or.
be laser, kind of laser resurfacing with some of the pitting acne just to help smooth the skin out. There's some products that can be somewhat helpful with that, but if it's really chronic and old scarring, then the laser resurfacing is a
Now,
good treatment.
just in general though, what kind of things I think do you feel are most important for men to watch out for in their health?
I mean,
Um,
we kind of talked about this before. I'm a big fan of anything prevention. Anytime you can get in front of things, it's easier as a physician to address and treat. When things are behind you, it's harder to go back and kind of correct and fix it. So anything you can screen, especially in men and ethnic men particularly, heart disease, cancer, are your biggest screeners. So getting your routine physical, getting your cholesterol levels checked. Sometimes EKG is necessary. Cancer screening, of course, colonoscopies, prostate, testicular examinations. So it's really going into, to have a good primary care doctor that is going to help guide you on the preventive things to get in front of. Because anytime you catch something early, be it a stage 1 or something, you have a much better chance of survival versus something that's a stage 4 that's already spread as far as cancer.
Well, there's some other things that might plague men, at certain ages, or depending on their diet or their recreational activities.
Oh, absolutely.
Like impotent. What is that? The
Erectile dysfunction.
Dysfunction.
ED.
When is it time to talk to a doctor if you feel like you have a problem?
I mean, there's definitely a psychological component of that as well as a physiologic, so mental and physical component. Some of those things could be picked up in your preventive screening when they're checking labs. If you have a deficiency, that could be affecting you. You alluded to particular habits, be it smoking cigarettes, smoking marijuana, alcohol intake. All those can affect a man's ability to have an erection too. So addressing some of those, and never going to tell somebody not to do things, but if it's affecting that part of your function and lifestyle, then it's something to really think about minimizing or not doing at all. Of course, there are a lot of ads out now, for if you have low testosterone, or some of the urology places are doing some shockwave type things. Again, I'd like to get at the root of the problem with what is it, and of course with aging that's going to occur, and everybody knows the blue pill. So,
and even that is important to make sure that your blood pressure and stuff is good,
absolutely.
right?
With any medication, you want to know the side effects, the interaction with other medications too.
What about antidepressants and erection dysfunction?
More the side effect, honestly, with the more common antidepressants are ejaculatory issues. We're getting down and dirty, so your ability to ejaculate can be affected with antidepressants. Sometimes that is helpful if you have a man has an issue with premature ejaculation. Some antidepressants can help with that. Certain other categories of antidepressants can cause some issues with erectile dysfunction. So, again, I'm maybe biased, but I think some of that should be talked with a healthcare provider. I think the advent of the internet, people were researching things, and some of the information on the internet isn't necessarily, solid or true.
I know a lot of people do kind of self-diagnose off of the internet. It'll scare the hell out of you,
I know. Even, legitimate ones like WebMD, they have to cover themselves, so they'll touch on a lot of the interactions and side effects.
I think the like WebMD and stuff like that is more generalized for like a collaborative of population, not really just like individualized, type of diagnostic stuff. Interesting. Where's your office located?
I'm just south of Cherry Creek on Jackson and Alameda, so not in the busy area of Cherry Creek North, but not too far from the mall.
Yeah, it's a nice little office that you have there.
We have a website if anybody would want to go to the website, more on the aesthetic stuff.
What is that?
Things that I do. www.aamedspa.com. Just to kind of keep it simple, although we really don't do spa type of services, no more facials or eyebrow tinting or things like that. But when I first opened, I did that, but we kept the website because it's simple, with just those initials.
Well, good. Check out Dr. Paris anytime.
Ageless Aesthetics, medical skincare and laser clinic.
That's it. Check him out. If you guys, especially the men out there, if you guys have any issues with your face, skin, and if you even just need like some general questioning for physical stuff, He's always happy to help you and also refer you to someone that can follow through with your care. All right,
Thank
you
you.
heard it first at Hollywood's. Chop it up with Shelly.